The EMDR is a psychotherapy treatment that was originally designed to alleviate the stress associated with traumatic memories. The EMDR therapy is an integrative psychotherapy approach that has been extensively researched and proven effective for the treatment of trauma. And how does this therapy work? When a person is upset, their brain cannot process information as it does ordinarily. Trauma may feel as bad as going through it the first time because of the images, sounds, smells, and feelings haven't changed. Such memories have a lasting negative effect that interferes with the way a person sees the world and the way they relate to other people. EMDR have a direct effect on the way that the brain processes information. Following a successful EMDR session, the patients will still remember what happened, but it is definitely less upsetting. There's been numerous control studies show the EMDR produces more improvement than the absence of the treatment, at least for alleviating the symptoms of PTSD, such as those triggered by rape. Most studies indicate that EMDR produces more improvement than when therapists only listen to a client's problem, but do not attempt to intervene directly. As a conclusion, EMDR alleviates symptoms of traumatic anxiety better than doing nothing, and probably better than talking to a supportive listener. But there's no evidence existed that shows EMDR is superior to exposure-based treatments as behavior and cognitive behavior therapies. The EMDR treatment's goal is to alleviate the distress that's associated with traumatic memories, and thus also lots of other therapies' approach. But EMDR appears to be similar to what occurs naturally during dreaming of REM, rapid eye movement, sleep. Therefore, EMDR can be thought as a psychological-based therapy that helps a person see disturbing material in a new and less distressing way. Scientific research has established EMDR as effective for post-traumatic stress disorder. However, therapies has extended this treatment to a host of other conditions, including depression, sexual dysfunction, schizophrenia, eating disorders, and even the psychological stress generated by cancer. More than 30 positive control outcome studies have been done on EMDR therapy. Some of the studies show that 80 to 90% of single trauma victims no longer have post-traumatic stress disorder after only 3 of 90-minute sessions of treatment. Another study found that 100% of the single trauma victims and 77% of multiple trauma victims no longer were diagnosed with PTSD after only 6 of 15-minute sessions of treatment. And 77% of combat veterans were free of PTSD in 12 sessions. There has been so much research on EMDR therapy that it's now recognized as an effective form of treatment for trauma and other disturbing experiences. Over 100,000 clinicians throughout the world uses this therapy. Millions of people have been treated successfully over the past 25 years. Some EMDR proponents have called it a miracle cure and paradigm shift, and some proclaimed it an exciting breakthrough in the treatment of anxiety. But in fact, EMDR is only an efficient treatment method, but it does not have a magical effect as it may sound like. For resources, I would like to share this website with you. The EMDR International Association is a professional association where EMDR therapy practitioners and EMDR therapy researchers seek for the highest standards for the clinical use of EMDR. This website provides information to the greater EMDR community, including clinicians, researchers, and the public that their members serve. Fun fact: one day in 1987, Francine Shapiro, a California psychologist in private practice, went for a walk in the woods. She had been preoccupied with a host of disturbing thoughts. She discovered that her anxiety lifted after moving her eyes back and forth while observing her surroundings. So Shapiro tried out variants of this procedure with her clients and found that they too felt better. That's how EMDR was born. Thank you for watching. I have attached a YouTube video and the sources in the description of the video under.